Hello, everyone, and welcome to today's webinar. My name is Mike Wolf. I'm from the North Dakota Association of Counties and the County Employer Group. And today's webinar is part of our mandatory training for our workforce safety and insurance safety program with the County Employer Group. So we're doing some mandatory training on claims management and drug-free workplace. Some of this is some refresher training, but some very important information that you need to be trained on should you have a workplace accident. So we'll get started with today's session. I'll be giving you my contact information at the end. So if you need to get a hold of me, you can certainly send me an email or give me a phone call. We're going to talk about incidents today in the workplace, and incidents are any time an employee might have some type of an exposure, maybe to a bloodborne pathogen, maybe it's chemicals in the workplace, maybe you have an injury or some type of an accident, but you don't need to go seek medical attention for that accident. So you could be walking down the steps and you could slip and you could trip, and you said, you know what, I feel a pain in my back, but it's not bad enough that I need to go see a doctor. We need to document all those incidents for you in the workplace, because if something doesn't heal properly and a week from now or 2 weeks from now you decide you need to go and see a doctor because your back hasn't gotten any better, now the burden of proof is going to be put on you that there was actually a workplace accident if you didn't report that the day that it happened. We have a lot of county employees that work by themselves throughout the course of the day, and so there aren't always a lot of witnesses to people's accidents. So that's why it's very critical that you do report your incident. So in order to report your incident, we've made that very easy for you. There's no paperwork for you to fill out. All you need to do is contact your supervisor and your risk manager in your county, and they will take care of all the paperwork for you. Now, you may have different reporting procedures within your county, so just please make sure that you know what those reporting procedures are in your county. If you don't know, please be sure and ask your risk manager, because they may vary from county to county, so please make sure you understand that. People ask me all the time what should be reported and what shouldn't be reported. Cuts and lacerations. When I train in road departments, people kind of chuckle. They say, well, we could have a cut or a laceration every day or every week. Or if people get paper cuts in the office, they don't think much about that and have a tendency not to report those. But if people don't take care of those cuts and lacerations, or maybe you have some other underlying medical condition that prevents that from healing properly, maybe a week from now or 10 days from now, an infection develops, and now all of a sudden you want to go seek medical treatment and you didn't report or document when that happened. Now it's going to be very difficult for you to do that. First of all, your employer's going to be very skeptical because you didn't report that workplace accident. And if you come and say, you know what, I hurt myself 2 weeks ago, I thought I would get better, but my back hasn't gotten any better, and I'd like to go see a doctor now. First of all, your employer is going to be very skeptical of that. They're going to say, well, I know you like to hunt, bowl, garden, golf, fish, do a lot of different things. How do we know that that happened at work? And workforce safety and insurance is going to be even a bigger skeptic, because after all, they are an insurance company. And what's one of the primary things an insurance company does when a claim comes into their office? First and foremost, they may look at ways to deny that claim rather than pay the claim. And if we have a 2-week lapse in reporting an incident in the workplace, an injury that's occurred, it's a good basis for workforce safety and insurance to deny your claim. And I was training in a road department, and one of the road department guys raised his hand and he said, that's exactly what happened to me. He said, I cut my finger. I thought it would be okay. I didn't really take care of it that well. And a week later to 10 days later, I had an infection. I went back to file a workers' comp claim, and they ended up denying my claim because there were no witnesses to that accident, and I couldn't prove that it happened 10 days earlier, and so they denied my claim. So that's exactly what we want to try to do, is make sure we get everything documented for you so that if you need to go see a doctor at some point in time in the future, we've got that all documented for you. Strains and sprains are pretty obvious. When you have a twist to your back, your knee, your neck, those type of things, that's a pretty clear-cut situation where you know you've got an injury, and we really want to document those too, because we might have to make some accommodations for you in your job, and we don't want you to hurt yourself any further. So it's very critical that we know about that and we can get that documented for you. One of the biggest areas where we have probably the most exposures but the least amount of reporting of incidents is exposures to bloodborne pathogens, especially in our law enforcement areas, our jails, and our social service areas. We have exposures to bloodborne pathogen issues probably on a daily basis. And again, those people say, well, I could report almost every day an exposure. And the answer to that is yes. If you do have an exposure, please document that, because we need to know that. Because if you're diagnosed with hepatitis C at some point in the future, we would like to have a good track record for you of potential exposures that you've experienced throughout the course of your career. A lot of times our employees don't know that they have hepatitis C until they go in for a regular doctor's visit, and the blood work comes back and the doctor says, oh, by the way, you have hepatitis C. Now, where did that come from? Did that come from a work-related incident that you were exposed to? Or did that happen maybe when you grabbed the grocery cart handle at the department store or the grocery store, and there were still live antibodies on that grocery cart, and now you touched your mouth, your ears, your eyes, your nose, or you got it in an open wound area at different times a year? People's skin gets drier and your fingers crack, and now those are open wound areas. And so is that how you contracted that bloodborne pathogen disease rather than at work? And what Workforce Safety and Insurance will do, they'll look at your work history, see if any incidents have been filed, and they'll look and say, you know what, this person works for the county for 10 years, and we don't have any incidents reported for bloodborne pathogen exposure. So how could this possibly be a work-related injury when, in fact, you've probably had several exposures over the course of your career? Sometimes we don't know about exposures until after the fact, especially maybe chemicals. If you go into a meth house or a crack house and the chemicals that are there, people react differently to that. So if it's after the fact, we still want to know about that. And so make sure that all of your exposures to bloodborne pathogens are reported. Depending upon how that exposure takes place, if you come in contact with blood or saliva and it just gets on your skin and it doesn't go into any open areas as far as you know, we certainly want to continue to document all of those cases. But especially if you have a exposure where that blood or that saliva gets into an open area, your eyes, your mouth, your nose, into another open cut that you have, we will have you do a baseline blood test because of that exposure. And then there's about a 2-week incubation time period before bloodborne pathogens show up. So about 2 weeks later, we would have you do another blood test to determine if that specific incident caused you to contract a bloodborne pathogen disease. So again, it's very critical. There's nothing too minor not to report to us. We would rather have you report several incidents that occur in the workplace than to have those go unreported, and then all of a sudden the burden of proof is on you, and we can't actually prove that any exposures you had caused you to contract a bloodborne pathogen disease. We have other individuals in the counties too who are exposed to chemicals in our road departments, our maintenance staffs, and people react differently to those. Some people have reactions when they just inhale it, and sometimes they have reactions if it gets splashed on them. So please let us know of those incidents as well. Repetitive motion discomforts, ergonomic related injuries are probably the fastest growing workplace accident in the United States. People sitting at their computers all day. We have people driving heavy equipment, and there's ergonomic issues related with that. If you're working in an office setting or even driving equipment, I know it's very difficult when you're driving equipment, but we want you taking stretch breaks every 20 to 30 minutes. If you're in an office setting, you should be taking a stretch break every 20 to 30 minutes. Get up, move around, get the blood flowing, readjusting your eyes and those type of things. We don't want you sitting around for long periods of time and that static pain setting in, that chronic pain setting in, and now you've got a pain in your neck, shoulder, back that's very difficult to go away. And if you do it long enough, that chronic pain doesn't really go away. You learn to deal with that. You never miss work, but you learn to deal with that. So if there's ergonomic related incidents, please let us know, because we do conduct ergonomic assessments for people to determine what may be wrong in their workstation. And it's not always about buying equipment. A lot of times it's just making sure your workstations are set up properly and making the proper adjustments in the workstation. And so even driving heavy equipment, one thing we're keeping our eye on now maybe is in the law enforcement area, because it's repetitive motion issues and it's still a relatively short time that people have had computers in their vehicles. People are sitting in awkward positions working on laptops. And so we're kind of tracking that to see what kind of incidents may come up in the future related to ergonomics. So again, please don't hesitate to report an incident. Contact your supervisor, risk manager, that incident is occurred, and the proper paperwork will get filed, and just make sure you know the proper reporting procedures in your county. Now we have your injury that's occurred. Maybe it's that incident that occurred last week or 2 weeks ago, or maybe it's something that just happened today and you decided you need to go see a doctor. So your back might have not have gotten better from your incident 2 weeks ago, and you decide you want to go to the doctor, or maybe it's something that happened today that was bad enough you need to go seek a doctor. Again, you need to contact your risk manager and your supervisor immediately to notify them that an injury has occurred. And make sure you know what the reporting procedures are in your county for filing a claim. Some counties have the risk manager do it and the supervisor, and some counties have maybe the employee or the supervisor file their own incidents and workplace injury claims, the first report of injury. So please, it's important to make sure you know what your reporting procedures are in your county. If your injury isn't reported to Workforce Safety Insurance within 24 hours, the county can be penalized up to $350. And that's a benefit for employees because it encourages employers to file their workplace accident claims. A lot of private employers try to discourage their employers from filing claims, but in the county employer group, if you're injured, we want to get that filed as soon as possible so that we can get you the proper medical treatment. Now, as far as reporting procedures and timelines, if you do shift work or any time after normal business hours, after 5 o'clock on a Friday, for example, if you work shift work or you get called in over the weekend, such as our road departments where they might have to plow snow or something like that, and you get injured during the weekend, we really need to have you document that as well, letting your risk manager and supervisor know. And we have until Monday to file that to meet the 24-hour reporting requirement. And if Monday is a holiday, then we have until Tuesday. So if you're injured doing shift work or working on the weekends, do know that we have till Monday to get that information filed. Workforce Safety and Insurance has a designated medical provider program, and they require all employers to be a part of this program. And it's a program in which the employer is required to designate medical providers, and employees have to go to those designated medical providers if they are hurt at work. And this is an important part of this training, that you understand who your county's designated medical providers are, because if you don't know who they are and you don't go to that designated medical provider, it's a basis for workers' comp to deny your claim. You're going to have to sign a form that looks like this. Your risk manager or your department head will be getting this to you. And on the top of this form, the county will list the providers that they've selected as your designated medical providers, any hospitals, clinics, or whatnot. Now, you might say, well, what if I don't go to the designated medical providers that the county has selected? You're able, in the lower 2/3 of this form, to select any designated medical providers you so choose, in addition to the ones that your county has selected. So if you choose an additional designated medical provider, it doesn't mean you can't go to the ones that the county has selected. It just gives you additional options. So a lot of counties do not designate a chiropractor. Some counties do, some counties don't. If your county has not designated a chiropractor, for example, as a designated medical provider, and you've gone to a chiropractor in the past and you think your chiropractor's done a good job, and you would like to have that opportunity to see your chiropractor for a work-related injury, you need to list your chiropractor on this form. If you don't list your chiropractor on this form, then you cannot go there for your initial treatments. And what do you think the likelihood is of a doctor if you ask them to refer you back to your chiropractor? Probably slim and none. So that's why it's important that you add that chiropractor onto this form, or any other designated medical provider you choose to be added to this form. I did have a good question in one of our sessions from a veteran. He asked, if I go to the VA hospital, would I be covered for a workplace accident? And the answer to that is no, unless he lists that VA hospital, the VA hospital, as a designated medical provider. And so if you do list that, it just gives you another option to go. It doesn't mean you have to go there. You can still go to any of the county's designated medical providers. You're only giving yourself additional opportunities to do that. Now, dentists and optometrists, your ophthalmologists, your eye doctors, all the cases we've seen that involve employees going to an eye doctor or a dentist have been treated as emergency care by workforce safety and insurance. And if you need to go somewhere as a result of an emergency, if you need to be taken by ambulance somewhere outside the medical provider network of where you live, this designated medical provider program does not come into play. We're more concerned about getting you the best medical care for that injury. So optometrists and dentists, listing them, you can list them if you want, but I'm not telling you you can't, but I don't think it's necessary to do it. All the cases we've seen have been treated as emergency care by workforce safety and insurance. And if you have your tooth chipped or your tooth knocked out, it doesn't make sense for you to go to your medical doctor who's just going to tell you to go back to your dentist, because there's nothing he can do for you there. So dentists and your eye doctors, if you want to list them, you can. But other than that, I don't think it's necessary, because it's been emergency care. So this is a form you're going to get to complete on an annual basis. Some counties have you fill out a new form every year, and some counties have you initial down at the bottom under the year that you've been retrained on this designated medical provider program, and you have to sign off in the middle of this form for your designated medical provider and drug-free workplace training as well. So if you have any questions on that, you can contact me after the webinar. I'll give you my email address, or certainly get a hold of the risk manager in your location, and they will certainly be able to help you with the designated medical provider questions you may have. Okay, now you're at the doctor's office, and there's a doctor's report of injury. It's a C3 form. It's a workers' compensation form. It's a capability assessment report, and it's a report that the doctor lists the restrictions that he's placing upon you due to your workplace accident. And we tell you, don't ever leave the doctor's office without getting this form. That's easier said than done, because doctors don't always like to fill out paperwork. They get paid to see patients, and they may tell you, I'll mail it in, I'll email it, I'll fax it, I'll file it online. And they probably will do that. It just might take 2 or 3 days to get there. And technically, if we don't have this C3 form, we can't let you come back to work, because if we don't know what your restrictions are, we can't let you come back to work, because we don't want you to hurt yourself any further. So if the doctor's placed a 25-pound lifting restriction on you, the last thing we want you to do is come back to work and lift something more than that if you do that on a regular basis at your job. So if you don't get this form from your doctor, let your supervisor and risk manager know that. If the risk manager knows you're going to the doctor, I guarantee you your risk manager will be asking you for this form. So if we don't get this form and you have to wait 2 or 3 days for that form to come in, technically we can't let you come back to work, and you're going to have to take 2 or 3 days of vacation waiting for this form to come in. And technically, I think you can use your vacation much better than that, than just waiting for a doctor's report to come in. So if we don't get that report, your risk manager and our internal claims manager, Jennifer Mormon, located in Bismarck, will do everything they can to get that form for you, and I guarantee you they'll get it for you the same day, so that we can find out what those restrictions are, so we can bring you back to work and make whatever accommodations we need to in the workplace. Now, it's important, too, to know what the restrictions are the doctor's placed on you, and also that you need to follow those restrictions both on and off the job 24 hours a day, 7 days a week. A lot of people think that they were injured at work, so the only time they have to follow those restrictions is when they're during their working hours. When in fact, if the doctor's placed a 25-pound lifting restriction on you for the next 2 weeks, you can't lift anything over 25 pounds for the next 2 weeks, 24 hours a day, 7 days a week. And if you do that and you hurt yourself worse, it's a basis for workers' comp to deny your claim. Okay, so make sure you know what those restrictions are and follow them on and off the job until the doctor has released you from those restrictions. We also need this C3 report after every subsequent office visit. So if you have a follow-up visit or visits, we need one every time you go back to the doctor. And the thing I recommend doing is contacting your risk manager before you go to your follow-up appointments and ask them for a C3 form, because we find a higher success rate if people take a C3 form with them to the doctor's office and actually hand it to them. There's a higher likelihood that the doctor will fill that form out rather than you just asking them to fill that form out. So we need to have this form filled out on every subsequent visit. Again, if you have any questions on that, we're happy to help. Now we'll talk a little bit about our transitional return to work program. We've got probably the most comprehensive return to work program in the state of North Dakota. We've been very successful with our return to work program. We've trained private employers on our program because they've heard of our success with this program. And this transitional work program is a program where we bring people back to work as quickly and safely as possible in predefined temporary job assignments. So if you're hurt, we're going to bring you back to work in some capacity. And our program lends a lot of credibility with the doctors because we developed a transitional job manual that is full of very thick manual, full of hundreds of potential transitional jobs that people can come back to if they're hurt at work. And that lends a lot of credibility with the doctors because they can look at actual job descriptions that talk about standing, sitting, bending, stooping, lifting, temperature extremes you might be exposed to. And the doctors can determine by looking at these job descriptions exactly what you can do. And I can hear people saying, well, why are you rushing me back to work? I got hurt at work. Shouldn't I be able to go home, sit at home and rest and recover? Well, doctors will be the first to tell you that work is therapy. Doing something is better than doing nothing at all. So that's why we bring you back to work, to help you transition back to your regular duties. And I'll tell you the main benefit of this program for you in just a minute. But depending upon the nature of your injury, transitional work is usually only for a 2 to 4 week time period. It can be longer than that if the injury is much more severe than that. But generally, we're talking 2 to 4 weeks. And we always try to transition people back to their regular jobs in their own department. If you're working in an office type setting, we're going to be able to bring people back in office settings almost 100% of the time to their regular duties, and they're going to be able to continue to do their regular duties. We just might have to make some accommodations to sitting and standing and those type of things in office settings. But if we have an injury where you can't perform your regular duties 100%, then we're going to look at other areas within your own department of where could you do something within the restrictions that the doctor's placed on you. And nobody decides when and where or how you will come back to work other than the doctor. So it's only based on the doctor's recommendation that you come back to work in some capacity. So if we have a road grader driver in our road department who can't drive his road grader because he has a shoulder injury, we're going to look within his own department. Is there something in the shop that that employee could do that falls within the restrictions that the doctor's placed on you? If there is, then we will do that. If there's not, then we're going to look at another department, and are there jobs in other departments that that employee could do to fall under the restrictions that the doctor's placed on them. And we will have several different options because we work very closely with the employee, the supervisor, department head, commissioners at times, and the risk manager to develop viable return to work options. A lot of employers tell doctors that they have a return to work program, but you know what that return to work program is? It's, hey, come on, get back to work. I need you. We're busy. You need to work. And employers aren't concerned about the safety and well-being of the recovery process for their injured employee. But in the county employer group, we are, and we're going to bring you back to those safe jobs that the doctors have signed off on. And if that means it's being in another department, we will do that during that transitional period. So the basis of our program is we're focusing on your capabilities when you're injured and not your disabilities. What can you do rather than what can't you do? And always the number one question we have is, what are the benefits for me to rush back to work or come back to work? And here's the main reason why we developed this program. We developed this program so that injured employees are able to maintain 100% of their earning potential. You're able to continue to earn 100% of your salary. If you go on workers' comp disability benefits, they only pay 2/3 of your weekly wage and disability benefits. Plus, they cap the amount of benefits that an injured employee can make. And most of our county employees earn enough in salary that they're affected by the workers' comp and benefit cap. So now we've seen people go from 100% of their salary down to 50% of their salary, and having any reduction in your salary for being on workers' comp disability benefits for a workplace accident that may not have even been a fault of your own causes financial hardships for people. And we don't want to put people through those financial hardships because we saw it happening, and we wanted to do whatever we could to eliminate that from happening. So that is the main reason we developed our return to work program, to allow you to come back to work in some capacity and be able to earn 100% of your salary while you transition back to your regular duties. Also, you get to maintain your other benefits, your health insurance, maybe your retirement, maybe if your location pays for vision and dental, those type of things, you get to keep all of those benefits. A lot of private employers tell their employees, hey, you're not working, so I'm not paying your benefits. I'm not paying your health. I'm not paying your retirement until you come back to work. And now all of a sudden you don't have those benefits that you rely on. And it also maintains your job security. In the private sector, again, a lot of times employers hire somebody to replace you, and now all of a sudden you don't even know if you have a job to go back to. So through our transitional work program, everyone is educated on the return to work process, from the employee all the way up to the commissioners, and everybody knows exactly what that plan is and when that person is expected to be back to their regular duties. So a very good program that we have set up for you to know that if you are injured at work, we are prepared to address that. Safety concerns in the workplace. Safety concerns are recognizing and reporting hazards in the workplace that you might be faced with on a daily basis or every once in a while. We rely on county employees very heavily on reporting hazards in the workplace because you know better than anyone else what hazards you're exposed to. Now, the problems we deal with a lot of times is employees know hazards in the workplace, but we become so complacent in our job duties that we take shortcuts around some of these hazards. And the reason we take hazards and we continue to take chances with these hazards is because we've never been injured yet. And we say to ourselves, well, I've never been injured, so why should today be any different than any other time I've performed this task, knowing that it's not a safe way to perform that task? So we want to know about those hazards so that we can take the corrective action to fix them in the workplace. Sometimes correcting those hazards costs money, sometimes it doesn't. If it costs money, we might have to get authorization from department heads, from budgeting or commissioners through the budget, but at least we can notify people of what those hazards are to prevent them from being injured. Maybe your coworker, maybe even a county resident, and when a county resident gets injured, then we have a high liability issues with that. And we really want to be proactive versus reactive in reporting hazards and doing our jobs the right way. Far too often we see situations where somebody's been injured at work because they did a shortcut or bypassed a safety procedure because they'd never been injured before, and all of a sudden they got injured. And now all of a sudden this issue becomes a big priority in that county or that location. before everybody knew about the hazard and they tolerated it because nobody got hurt. But all of a sudden, when somebody gets hurt, now all of a sudden it becomes a big priority and it needs to be taken care of. The unfortunate thing with a situation like that is somebody had to go through an injury and the pain and suffering of being injured for that hazard to be fixed. So we really need your assistance in addressing those hazards. Here's a county location. I went out and I went into the shop, and on the picture on the left, you can see the road signs laying on the ground. It was winter time, so boots and shoes are wet, slippery maybe. And the reason these signs are sitting here is because people have walked over it many times. They told me at the shop no one has ever been injured. And so there's their complacency in doing that. They continue to walk over those because they've never been hurt before. So why should today be any different? But maybe today's the day is that you slip and fall on one of these road signs and hurt yourself when it should have never happened. On the picture on the right, you can see a shelving unit that the county had taken the time and effort and plan to build to hold all their road signs, yet they've made a conscious effort not to utilize it completely by leaving these road signs laying on the floor and being a big hazard to not only the employees, maybe their coworkers, or maybe even county residents who come through. How many people think that this is a safe operating procedure? Well, again, complacency in this guy's job. He's probably done things like this 100 times before, but the key is he's never gotten hurt, so he's going to continually take chances until he gets hurt. But what if today he ends up leaning maybe 5 or a little further to the left or a little further to the right than what he planned on, and all of a sudden that ladder goes slips and falls through the open areas in that railing, and he falls 10 or 15 feet to a concrete floor. Now, the funniest thing to me in this picture is the guy holding the ladder with one hand, thinking that if this guy slips, he's going to be able to hold him up, which he's not going to be able to do. And there's a lot of different ways this guy could be performing this task by getting a roller, a paint roller, and an extension pole, and being able to use a roller pad to complete that job. If you have the personal protective equipment you've been provided with in your county, please make sure that you use it. If you don't have it, please do everything you can by asking for it, and we will do everything that we can to get that personal protective equipment for you. It doesn't do any good to have your personal protective equipment that the county's gotten you and have it sitting on the shelf. Okay, so if it's there, please use it. Most of the time, when people don't use personal protective equipment, it's because supervisors and department heads and commissioners don't make it a priority. And if supervisors and department heads and commissioners don't think wearing personal protective equipment is important, how can we expect our employees to think it's important as well? So supervisors, department heads, commissioners need to set examples when it comes to wearing the proper personal protective equipment, because if you don't, then employees aren't going to follow suit. And I talk to people all the time and ask them why they do or don't wear personal protective equipment. And we talk to social service people a lot of the time because we have a lot of exposures there, especially to bloodborne pathogen issues. And the number one reason social service employees tell me why they don't wear personal protective equipment, especially when they go out to meet with clients, is because they don't want to offend their client. Now, I haven't quite figured out if that's a viable excuse or not. There could be some validity to that. But really, shouldn't there be procedures in place in all our counties? And really shouldn't be the statement being made by our employees is, I'm sorry, but my employer requires me to wear this personal protective equipment. That's what our employees should be saying. We should be looking out for our employees. You should be looking out for yourself to protect you from any and every hazard in the workplace. Because the last thing we want you to do is be injured at work. We want to prevent that. But you have to take the necessary steps. You have to take it upon yourself to wear that protective equipment whenever and wherever it's needed, whether it's glasses, goggles, gloves, latex gloves, masks, gowns, whatever that is. Make sure you wear it, because it doesn't do any good for that to be sitting on the shelf. If it's there. If you don't have it, again, let us know, and we'll do everything we can to make sure that we get that personal protective equipment for you. Again, we want to be proactive rather than reactive. We don't want to wait till you've been exposed to a bloodborne pathogen or some other danger and then think all of a sudden that now personal protective equipment is important. I always give the example of when people go to a medical appointment and there's a nurse there or a doctor and they're drawing blood and they're wearing latex gloves or maybe even wearing masks at times. And I always ask people, do you feel offended when you see a nurse at a medical appointment wearing latex gloves when they're drawing blood? And I think the answer to that is no. I think we expect those people to be wearing them and protecting themselves. And we should have the same mentality of we should be protecting ourselves at all costs from any hazards that we're exposed to in the workplace. Now we'll talk just a few minutes about our drug and alcohol, drug-free workplace, and substance abuse policies. We tend to think that we're tight-knit groups of people in all our counties and in all of our locations and all of our departments, but the true hard facts are we deal with drug and alcohol issues all the time. And we're not unlike any other employer in the state of North Dakota. We are faced with and we have to deal with drug and alcohol issues in the workplace. And it all starts with having a written substance abuse policy, providing educations to supervisor and employees, and then providing information on available employee assistance programs. And we work with counties a lot on developing an effective drug-free workplace policy. And there's a lot of criteria that are involved in that and should be in that. And the issue we deal with a lot of times is we deal with 53 different counties, which are in essence 53 different entities. And each different county has a different priority on thinking what is important and what isn't important in a drug-free workplace policy, as well as any other policies they implement. So we work with them in trying to have effective policies, starting with pre-employment testing. Pre-employment testing is very critical. I think if we have pre-employment testing and we prevent one person from coming into the workplace that has a drug or alcohol issue, we've just done a great service to all of our employees in the county by preventing that person from coming into the workplace. And all the counties who do implement pre-employment testing, they say it works and it's successful, and they tell us about it all the time. They tell us the stories about getting to the point where they're offering somebody making a final offer on a job, and they tell them, before we can make this final offer, you need to pass a drug and alcohol screening. And guess what happens? They don't show up. They don't come back. Well, if that's the case, we just did a great service to all our employees because we did exactly what pre-employment and testing is designed to do by preventing that employee with a drug or alcohol issue from coming into our workplace. Reasonable suspicion. Every county has reasonable suspicion in their policies because that's the minimum you really have to have in a drug-free workplace policy. Some counties have random testing, some counties don't. And the number one reason why counties tell us they don't have random testing is because it costs money. And they don't have the money, or they don't want to invest in the random testing for all employees in their county. Now, I get questions a lot from the road department employees asking, why do we have to get drug and alcohol tested on a random quarterly basis and nobody else in the county has to? And the answer to that is that the road department, anyone who has a Class 1 or Class A license, gets randomly tested on a quarterly basis is a federal mandate. That comes from the federal government. Your county is not mandating that you be tested on a quarterly basis. That's a federal mandate. So that's why road department employees are randomly tested on a quarterly basis. Post-accident testing is another critical area, especially with motor vehicle accidents. A lot of counties don't have post-accident testing, but it's very important to have that as part of your policy, because if there's somebody under the influence of drugs or alcohol and that goes undetected, counties end up paying for very, very expensive workers' comp claims. They always tend to be in the thousands of dollars that those claims end up costing. But thankfully, to our law enforcement agencies, our highway patrol, sheriff's department, police departments, if they have any reasonable suspicion at a motor vehicle accident, they can order a blood test or a breathalyzer. And thankfully for their alertness at certain accidents that have occurred with county employees, they've ordered those blood tests and breathalyzers, and we found out that some of those people are under the influence of drugs or alcohol. And as a result of those claims have been denied by workforce safety and insurance because they were under the influence of drugs or alcohol. So it's important to have that post-accident testing. We're also working closely with counties to have in their policy a notification to the employer when employees are taking a prescription drug for a non-work related accident. Now, the first thing I can hear is people saying, well, it's none of my employer's business if I'm taking a prescription drug for a non-work related accident. Well, when you think about it, really it may be your employer's business if it's not allowing you to perform your duties at 100%. Now, the language we're working on, and I like to have in there, it's not mandatory that you tell the employer. We're suggesting, we're recommending that you do so, or we're encouraging you to notify your employer if you're taking that prescription drug. Because if you don't and you can't perform your duties 100%, now you're putting yourself at risk and your coworkers and maybe even county residents at risk because you can't perform your duties 100%. So as a result, we've implemented a non-occupational return to work program, much like our return to work program if you're injured at work. And if you come forward and tell us that you were injured away from work or you are taking a medication for something that doesn't allow you to perform your duties 100%, we will do transitional work for you for that short time period you may be taking that medication. And we did have a road department employee come up to me after one of my training sessions and told me, he says, yeah, I got hurt away from work. I'm taking hydrocodone, and it really affects my ability to drive my road grader. But I was afraid to say anything, and this is a situation where he didn't have enough vacation or sick leave because he was a newer employee, and he said, I was afraid if I told my employer, they would send me home, and I can't afford not to work. So we helped this individual transition back to work for that 2 to 3 week time periods that he was taking hydrocodone because he couldn't drive his road grader effectively. So that's the basis for this program, is that we don't want you to put yourself or anyone else at additional risk if you're taking a prescription drug for a non-work related injury that affects your ability to perform your duties. Every county has an employee assistance program. Either it's formal or informal. Formal is contracted services, and it's a paid benefit for the employees by the county. Or we have informal, where employers are basically informed about the names of facilities that provide EAP programs. Most counties do not pay for this service, but you should go to your bulletin board at your county or at your locations, and it will be posted there who your EAP provider is, your designee is, so that if you do need to seek professional help, you will know where the county is suggesting that you go. And what would you do if you knew you had a situation in your county where someone in your county had a problem with drugs or alcohol? The problems we run into a lot of times is people are friends in county government. Employees are friends with supervisors. Supervisors are friends with department heads and commissioners, and there's a whole mix of that friendship. So it becomes difficult for us to bring forth a situation where our friends do have drug or alcohol issues. But when we really think about it, shouldn't be that the first thing we do? Because if they are our friends, shouldn't we be doing everything we can to help them? Because if we don't, if we ignore it, then they ignore it, and we're enabling them. We're making excuses for them. We're covering for their mistakes at work. And I'll tell you, eventually something's going to happen. It's just the law of averages. If there's drug and alcohol abusers, something's going to happen. And a lot of our injuries when there's a drug or alcohol related accident happens to coworkers. It's much like a drunk driving accident. Most of the time, victims get hurt in a drunk driving accident, and a lot of our workplace accidents are the same that involve drugs and alcohol. The coworkers get hurt. So do you want to continue to put yourself at risk if you know someone has a drug or alcohol issue? But it is very difficult. We know that, but we should take the initiative to address that as well. And if you bring that forward, a good manager in your county will take that, and they will take the initiative with that and make the necessary changes to eliminate that hazard from the workplace. We don't bring these forward to get anybody in trouble. We only do it to help people, and we have to keep that in mind. But sometimes we have managers in departments that are friends with the people who are abusing, and they don't always take the initiative. Or maybe it's the manager that's the abuser, and we don't think anything will be done about it, even though people know about it, or it's been brought forth and nothing's been done. We always throw out this invitation to anyone that if you want to contact Jennifer or I anonymously, you can, because if you feel like you'll get in trouble or you don't want to get involved or whatever the case may be, that you don't want to bring that situation forward, please know that you can come to us and we will do everything that we can to help assist you in eliminating that problem in the county, and you won't be involved at all because you will have contacted us anonymously. And that's happened in a couple cases, and we've been able to make some positive changes and help people. And we could give you examples. I could go on for another half hour, 45 minutes talking about examples of the situations we've dealt with pertaining to drug and alcohol issues in the workplace. But we want to do some training. We want to try to eliminate those hazards and make our workplaces as safe as possible for all our employees. So that's all I have for this session on our claims management and drug-free workplace training. My contact information is on the screen, my phone number and email address. If you have any work-related issues, job site issues, safety issues, please don't hesitate in getting a hold of me. Jennifer Mormon, our internal claims manager who helps facilitate the medical management and return to work for all county employee injuries, her phone number and email is on the screen as well. She's more than happy to assist in any claims related matters that you may have. So please contact us if you do have any questions. Other than that, thank you very much for taking time out of your busy day to attend and listen to this session. Please let us know if you have any questions, and please have a great rest of your day. Thanks for attending.